Welcome to your Living Donor Evaluation at the Iowa Methodist Transplant Center. I am Angie, one of the Living Donor Coordinators. If you have any questions throughout the presentation, please write them down and we will discuss them later today. Here is a list of our transplant team members. You will have the opportunity to meet with them during your evaluation day later today. Here is a picture of our transplant team. Let's start by talking about the different types of living donors. There's living related, for example, would be a parent or sibling. Living unrelated, for example, would be a friend or a spouse. There's also a humanitarian, which is someone who has come forward to donate to anyone waiting on the list. We usually have about 4 to 5 humanitarian donors per year. Advantages to living donation. The surgery is planned. The donor will get to choose the date of surgery. There is minimal cold time during a living donor surgery. The kidney leaves the donor OR room and enters right next door where the recipient is prepped and ready for transplant, allowing the kidney to work right away. On average, a living donor will last 25 plus years. On average, a deceased donor transplant will last anywhere from 5 to 12 years. Because the kidney functions right away, the recipient will feel better quicker, likely avoid dialysis, and allows for an easier recovery post-op. There are different organs that can be donated: kidney, a part of the liver, a lobe of the lung, or a portion of the intestine. This slide is very important. You may stop this process at any time, including the morning of surgery. If at any time you change your mind, it's okay. You will not be on the hook for anything. You will not receive any bills from us. If you are unsure how to tell your recipient, we can help you do that, or we can do it for you. Talk to me or any of the other team members. If you are uncomfortable telling us, you will meet with someone later today called an independent living donor advocate. You can discuss that with them, and they will have the conversation with us. You have several options to opt out at any time. Here's a list of our exclusion criteria. Our job is to do what is in the donor's best interest, even if that means turning them down as a donor. Please take a moment to review this list. As a donor, you are evaluated separate and not alongside or with your recipient. Again, this is to ensure that we were doing what's in your best interest. You have received and reviewed the informed consent prior to your evaluation. Today, we will review this again and go over any other questions you may have. Each donor goes through an extensive workup process. During this process, we may identify health conditions or concerns you were not previously aware of. If this happens, we will discuss that with you. This may result in you being turned down as a donor. Please take a moment to review the risk list above. Here's a list of paperwork we will go through later today. Please take a moment to review the list. There are several phases to a living donor evaluation. You should have already spoken to one of our independent living donor advocates, and you have passed through the pre-screen process. Now you are here for your evaluation. You should have completed your testing yesterday. Today, you will meet with the team, and we will go over your results from yesterday. Here are the different blood types and their compatibilities. This slide shows who can donate to who. When we look at matching, we look at 3 different things: tissue typing, blood type, and cross-match. These tests show us if you and your donor are compatible. If you have what we call a positive cross-match, this is unfortunately not a good thing. This tells us that the recipient will reject your kidney. We will not be able to move forward with a transplant in this case. There are other options for a donor and recipient that are not a match. The most common is a paired exchange. This can be done through our center or through a national paired exchange program. If you are not a match to your donor, we will talk more about this later today. This is what we call the paired exchange. On the left, you'll see there's a mother and a son who are not compatible, and a husband and a wife on the right who are not compatible. Here we would swap the donors, allowing for 2 transplants instead of none. Your donor workup is paid for by the transplant center. If you receive any bills or any statements from your insurance company, please let us know and we can help fix this problem. Your surgery is called a robotic laparoscopic nephrectomy. Our surgery day is on Wednesdays. You will stay in the hospital for 2 days. Most people discharge on Friday afternoon. Depending on your job, you should be able to go back to work in as early as 2 weeks. If you have a more physical job, you may be looking at 4 to 6 weeks before returning back to work. Here is a kidney transplant picture. Notice we do not remove the old kidneys. They stay where they are. The new kidney is placed in the front, either on the left or right side in the pelvis. As with any surgery, there are risks. Donation is no different. The surgeon will discuss this in more detail with you later today. After surgery, you will stay on our transplant floor, which is Junker 5. You may have visitors. There's a pull-out couch in the room for someone to stay if you want to. You'll have a Foley catheter in place that'll be collecting your urine. This will come out the next morning. You also will have an IV giving you IV fluids until you're eating and drinking better. They'll start slow with liquids and they'll advance your diet as tolerated to solids. When you're ready for discharge, one of our coordinators will go over your discharge instructions, including any follow-up appointments and a prescription for pain medicine. Follow-up after donation. Follow-up is very important for you as the donor and also for our program. After leaving the hospital, we will see you at 2 weeks and 4 weeks for a post-op checkup. For long-term follow-up, we will contact you at 6 months, 1 year, and 2 years. This time we will check in via phone or email. Again, these follow-ups are very important. They're time sensitive, and we ask that you please complete these as directed. Along with this, we ask you to see your doctor every year to complete a physical. Thank you for considering donation. We are happy that you're here. We look forward to meeting you soon. Please hang tight and someone will be in to help you to your room.